Yes, hello. You probably remember me from yesterday, so don't worry. I promise not to be quite so controversial. I work in Alberta, and very many patients are in safety-sensitive positions. You know, they work in Fort Mac, they're in the oil fields, they're in construction, etc. And I've sort of come to a realization that I really can't write a letter that says they are safe to work in a safety-sensitive position. And I've decided that for a number of reasons. In Alberta, I don't have to write the percentage of THC. You do in Ontario, but I don't. I could say CBD only, and so for the length of that prescription, which might be a 3-month prescription, I could technically write that letter. But then I'd have to say in that letter, this is only good for 3 months, because if the patient comes back and says they need some THC to sleep or something like that, because the pure CBD, whatever, then that letter becomes null and void. So that just makes a sort of logistical problem. But far more importantly, a lot of patients are getting medical cannabis and going elsewhere to get cannabis. So I've decided that I cannot write the letter because I don't know what they're getting from elsewhere. Because patients come in and they've ordered gummies from BC, they've gone to some dispensary to get this, that, and the other. And if I write any kind of letter saying, you're okay, I'm saying you're okay, but I actually don't know what you're taking. So I'm completely, as of the beginning of April, I was beginning to think this through, thinking, I'm not going to write any of those letters. I don't know if you've got any other suggestions for what I could do.
I'd say it's the same thing with any other drug. With opioids, sometimes we don't know if patients are taking opioids from the streets, and you do a urine drug screening and you find some fentanyl that you're not prescribing. It's the same thing. So you deal with what my advice would be. You do what you can with what you know, and you advise the patient the best that you can. And you document that, tell the patient, if you're taking THC, some high content of THC, tell them, explain to them what is high concentration. I have patients, they did not know, well, that's what they told me. They did not know that 30% THC was high. They thought it was normal. And I had to explain to them, no, 30% THC, smoking, 10 joints a day, that's high. They did not know. Well, that's what they said. But so educating them, what you're using is high, and what you're using may impair your judgment, and you don't need to write a letter because you don't know, but at least you can document that you advise them, that you educated them, you give some brochures, you give patient education. Maybe you will be saving some lives just by educating them.
But the problem they stand with the unions is quite simple. When they go and sign on for a job, they will be urine tested. And actually, I was told by, I think it's Biopharma, that it could be a month between having some THC in your system and having a clean urine. So first of all, I've now got to tell them, I don't know, but it could be a month before, you could be taking your medicinal and actually signing on for your job with the union, scaffolders or whatever you are. If they're involved in any peripheral way in a safety incident, even if they weren't the person, if like there's 10 people and somebody did something, but there's 10 people, they will all get drug tested and they will lose their job. So they're in a very difficult position in many of these unions where the union is actually not protecting them. And I just saw a guy just a week ago. He is the union person for a big oil company. And he said, I want to get some THC stuff, he said, because I want to be the test case, because I've been trying to help these other union guys, because I don't care if they fire me, because I'm near retirement. That's a bit brave of him. But, it's a real issue, because some of these people might be on a very low THC, but the THC will be in the urine. They're completely okay to work, but it's a very complex problem because of the way some of and I don't blame the employers, but it's extremely complicated to how we can help them and they can keep working, because they will absolutely lose their job and they're absolutely out. And if all you are is a crane operator, there's no such alternative job that is not safety sensitive. And I can tell you, for the city of Edmonton, being a lifeguard is a safety-sensitive position, which of course it would be. You can't save somebody if you're high. But, it's got to the point where it's very easy for employers to say, safety-sensitive position, I need a doctor's letter.